A common bedtime boogeyman is keeping both kids and parents awake, and it's known as bedtime anxiety. As cases in children continue to rise, we are happy to be joined by Claire Couch, licensed professional counselor at MUSC Institute of Psychiatry. Claire, thank you for being with us today. And when we're talking about bedtime anxiety, what are some of the symptoms of this?
Absolutely, and they can range depending on the child, depending on the home situation. What we typically see is a lot of avoidance around bedtime, a lot of increased anxiety, meaning excessive worrying, having a hard time controlling that worry around bedtime as well. A lot of somatic symptoms such as increased heart rate, maybe stomach issues, maybe increased sweating and things like that. Definitely some of the more somatic symptoms are more common in the pediatric population as well.
And now how do we differ from, because I feel like all kids have, those times where they're, oh, like there's a monster under my bed, or, very common issues that children experience, but when does it cross over into a more pressing issue?
Absolutely. It's really when functioning on the day-to-day becomes an issue. If they're not sleeping well at night and it's becoming an issue with their performance at school, with their family, with their friends, and other realms of their life, if that starts to become impacted, that's when I would seek out professional help.
Okay. And now this is increasing. This is becoming an increasing concern. Why?
I think that there's a couple different factors that could be relating to it. One of the issues that I see the most is a lot of social media and comparing one experience to another behind the lens of a phone or a computer. And I think that a lot of people are comparing their experiences, and it's not necessarily accurate. Yeah. I also see that when I work with families in particular, it could be something that the parent is unknowingly passing along to their child. So that's a lot of the work that we do, as well as also parent coaching and helping them understand, okay, these are some skills that you can use at home to hopefully influence your child in a more positive way. Mm-hmm.
And now, have you been seeing an increase in your office of people coming in or children coming in with this?
Absolutely.
Wow, okay. So now what are some ways that we can treat this?
So one of the modalities of treatment that we use is called cognitive behavioral therapy for insomnia. A lot of people are familiar with just CBT, or cognitive behavioral therapy. And what CBTI does is it implements a lot of different rules for sleep hygiene. And so what we encourage people to do is maintain a really strong sleep schedule, trying to get to bed and trying to wake up at a pretty consistent time, even on the weekends and even during the summer, which can be really hard for some people.
Yeah. And now, are there any, mindfulness techniques or things that, parents can do with their children at home that will help if they're experiencing this bedtime anxiety?
Absolutely. We highly recommend muscle relaxation and imagery rehearsal beforehand. A tactic that I use with a lot of my kids and their parents is also trying to make a list of all of the things that you could potentially worry about before getting into bed, doing all that worrying beforehand so that you can get into bed with a clear mind. Okay.
And now Inside Out 2 is a movie that just came out. I personally have not seen it yet, but this is, to my knowledge, one of the first franchise movies catered to children that really talk about some important topics like anxiety. Would you recommend a movie like this for a family to watch and maybe pick apart a little bit?
Absolutely. And between Inside Out and Inside Out 2, they really do a nice job of breaking down the different emotions, but also normalizing that people feel them, and that different people will feel them in different ways and will express them in different ways.
Yeah. And so I know that you mentioned earlier briefly, but could you just remind us again, when is a good time to consult a professional for professional help?
Absolutely. I think that if you start to notice major changes, even if they're slight, I think that if it's going to be starting to impact the child on their day-to-day, I think that that's a good time to say, okay, maybe we should look a little bit closer into this.
Okay. And if we do decide to look a little bit closer, where can we go for professional help?
At MUSC, through the Institute of Psychiatry, the Sleep and Anxiety Treatment Program is where we all work. There's clinicians, psychologists, psychiatrists who all work closely together to help people with their sleep and anxiety disorders.
Awesome, Claire. Well, thank you so much for joining us today.
Thank you.
We're back in 2 minutes.